Good day, everyone. Today's article is titled Real-Time Guided Endodontics with a Miniaturized Dynamic Navigation System in Calcified Posterior Teeth, Performance in Regards to the Operator's Level of Experience. It was done by a group from Switzerland and was published in JOE in 2025. Static guided endodontics has been used in cases of pulp canal calcifications, which carry high risk of complications and treatment failure by having a higher precision and minimal invasiveness. However, static guides use templates and metal sleeves, which require sufficient interocclusal space and are difficult to use in posterior teeth and are limited in patients with reduced mouth opening. A dynamic navigation system has been introduced to overcome the drawbacks by using a camera marker tracking system to allow real-time handpiece guidance without bulky templates. So the aim of this study was to evaluate the performance, accuracy, and tooth substance preservation of a dynamic navigation system for endodontic access cavity preparation in calcified posterior teeth and to compare outcome when used by an experienced endodontist and less experienced general dentists. For the tooth model preparation, extracted human posterior teeth were micro-CT scanned, pulp chambers were digitally calcified up to the CEJ, teeth were duplicated and mirrored to create symmetric sets for all quadrants, teeth were 3D printed in quad duplicates, giving 192 standardized calcified tooth replicas mounted into 24 arches. For the imaging and planning, CBCT scans were taken for all 24 models. Digital surface scans were taken for the 12 models designated for the dynamic navigation group. In the planning software, each access cavity was virtually planned by positioning a bird towards each main canal orifice, designing a minimally invasive access, adding virtual markers and trays for the dynamic navigation system, and then custom trays for the dynamic navigation system were 3D printed. For the operators, the first operator was an endodontist in training with 7 years of experience, and the second operator was a general dentist with 3 years of experience. They both lacked prior experience with the dynamic navigation system. For the procedure, each operator performed access cavity preparation using dynamic navigation system on 6 models and conventional access cavity preparation on 6 matched models 4 weeks later to avoid memory bias. And for the substance loss measurement, after access cavity preparation, post-op CBCT scan were taken, pre- and post-op scans were superimposed, segmentation isolated the volume removed during access, tooth substance loss volume in cubic millimeters was calculated. For the results in regards to the tooth substance loss, dynamic navigation significantly reduced the volume of substance removed, and for the effect of operator experience, in freehand technique, the second operator with less experience removed significantly more tooth structure than the first operator, both in molars and premolars. In dynamic navigation group, the differences between the operator disappeared, with no statistically significant difference in substance loss between the experienced and less experienced operator. For subgroup insight, for the first operator with experience using dynamic navigation system, in molars, there was significant reduction in substance loss, but in premolars, there was no significant benefit. So dynamic navigation enables minimally invasive access in calcified posterior teeth, and the technique is operator independent. The benefit is most significant in molar, where anatomy is complex and operator error is more common. For experienced operator, dynamic navigation system offers small additional benefits in premolars, but remains advantages in molars. This study has its limitations. First, it is an in vitro study, which cannot completely replicate the patient movement and anatomical variability. Also, the use of single-colored resin teeth, which lacks natural dentin color cues that help in clinical access, and this likely increases difficulty and substance loss. And they have only 2 operators, which limits the generalizability, and performance variability may be operator specific. So, in conclusion, within the limitations mentioned, dynamic navigation represents a promising tool to improve treatment outcome and preserve tooth structure during endodontic access, especially for clinicians with limited experience, particularly in calcified molars where complexity and risk of procedural errors are highest. And thank you so much for listening.